The need for telemedicine in ROP. Now we all know that globally there are 15 million babies who are born preterm each year, and it is one of the leading cause of death in children under the age of 5. Now out of these 15 million babies, almost 3.5 million preterms are recorded in India alone. Screening for ROP is very effective and very worthwhile. But sometimes in some areas, skilled examiners to conduct dilated examinations there are very few skilled ROP examiners. Remote screening with retinal photography is a good alternative, is a very good strategy to basically progress and basically increase the outreach for ROP care. Not only this, the busy practitioners have to take out time and go to NICUs. So with telemedicine, it is much easier, much comfortable, and foremost point is whether it is reliable or not. Whether it is reliable or not, this has been studied at multiple centers. Our own Guj ROP program, which is led by Dr. Alay Bankar, they have reported good success. Vinekar et al. Doing Kid ROP program in Karnataka, they have seen more than 7,000 infants in this particular study, which they published. Overall incidence of ROP was around 22.4%, and most important was that the sensitivity was very high. A similar good sensitivity was noted in other countries, including France, Egypt, Chile. There are so many studies which have documented that this is quite a reliable way of problem which patients do require treatment. It is very, very important to find out during the telemedicine program which patients actually need treatment. So the actual work comprises of a team which has a validated and trained technician, a manager, a driver, and a vehicle in which the whole camera would be transported. With the advent of a better and a more portable camera like from Trinetra Neo camera, you can even it can be transported even in a very small bag. Now each team is equipped with this particular camera because that is the primary need, and then they travel on a fixed schedule, on a weekly timetable. They visit the same NICU at the fixed time and on the fixed day of the each week to maintain the follow-ups, because we all know that follow-ups are of prime importance in retinopathy of prematurity screening. The imaging protocol, we will see how it is done, but a base of imaging protocol is that we have to, at each session, the technician has to perform a simple intersegment photograph, a posterior one, a nasal, temporal, superior and inferior. Algorithm of how it goes. So basically, we have to dilate the pupils of the baby with the help of the diluted drops. You have to wrap the baby, disinfect the camera and the lens, put some antibiotic drops and anesthesia drops, put a speculum, and then you image. You take a posterior picture, nasal, superior, temporal, inferior, and a disc-centered picture. Now, after this, we have to wipe the baby of the gel which has been applied, and then we put antibiotic drops, and that is end of the whole examination proper. Now, this whole examination is then recorded. This is where it is recorded, and this particular chart I have taken from Dr. Anand Vinegar's published article, which is published in IGO 2017. So if anybody wants this chart, they can download or take it from there. But the good thing is that you have findings in one eye on one side, findings in the other eye on the other side. Mature vessels means green. It doesn't, you have to just discharge, you don't need any other follow-up. Orange means it needs a follow-up, and red means it needs referral to the ROP specialist. Every session has to be recorded in an ROP register that is maintained in NICU. Now this is not only important for follow, but also very, very important for medical legal aspects. ROP cards are given, but we do need a data that the child was examined and this was the findings. So looking at the medical legal aspect, I think telemedicine is even more important. Imaging is even more important, because now you can actually discuss, argue, and tell why a particular baby was examined, why a particular baby was injected, why a particular baby needed laser, and at each follow-up you can document it and show it to the patient. Mothers are contacted via voice or text messages just to remind them about their appointment in advance, and if the appointment has been lapsed or missed, the babies once diagnosed can be referred to the baby. Now we come to the second part of of it, the artificial intelligence for ROP diagnosis. Why do we need artificial intelligence for ROP diagnosis? Because most of the work done is subjective. Most of the work is done based on the thought process of the examiner. So artificial intelligence makes it much more objective. So one of the first programs was IE-ROP Deep Learning System, which was published in 2018. And for the diagnosis of at least plus disease, the sensitivity and specificity of the algorithm were quite high. The problem of AI implementation is the generalizability, explainability, and regulatory and medical legal issues, because once you have this, see, as a human, we have a thought process, we have arguments. There are two different thought process. There are two different opinions about a same particular disease problem. But with AI, whatever we have feed it in the system, whatever is the algorithm, it would just respond like that. So that also raises medical, legal, and regulatory issues as to who is responsible for a particular kind of treatment, when a particular why a particular kind of treatment was given, or why a particular patient or baby was missed. Now this photographs, I am thankful to Dr. Anand Chevruman, who has shared his photographs. Now these photographs are from a poster which they presented at World ROP meeting in Dubai. So you can see that they are trying to develop AI which can predict that this particular baby has a avascular zone and this may need treatment. So the future would have to be a workable artificial intelligence to increase the outreach and improve objectivity. For the attention and for the opportunity.